There are a lot of ways to really help people heal and help people think about getting to the root causes of neurologic, endocrine, immune disruptions that are part of the toxic stress response. And the stress busters, these are 7 ways that have been shown by science to improve neurologic, endocrine, and immune function. One is supportive relationships, having a safe, stable, nurturing relationship, and having a wide variety of relationships that really sustain you. So who can you call at 2 in the morning when you're feeling really down or need help? But also, who can I go to when I just need to think about a job or get education on what parenting thing to do for my kid who won't sleep? So just having all of those resources can be so healing and supportive. Sleep issues are so common for people who've experienced ACEs and are experiencing toxic stress. So how as a provider, can I help that person sleep? And that might mean maybe they're having trouble falling asleep because they're having so many worries about what's going on in their life. And then I can talk to them about journaling or talking with a protective figure in their life, a friend or a relative. Or maybe they're having nightmares, and then we can talk about treatments for nightmares that include cognitive behavioral therapy for insomnia or even medications. And then if I'm worried that they're not sleeping because of the stressors in their community and community violence or the parents fighting down the hall if it's a kid, then we can really address those root causes as well. So nutrition plays such a huge role in trauma. If I'm really stressed out and I'm in that sympathetic phase of trauma, then I'm not hungry at all. The sympathetic system and the adrenaline is actually shutting off my intestines and telling me, don't eat. If I'm in the cortisol phase of stress, then it's opposite. This cortisol is telling me to crave high-fat, high-sugar foods to stock up for the next threat. And as a provider, if I know those 2 things and I can talk to somebody and maybe the reason they're not eating is because they're in that sympathetic stress phase, and so then I might want to target how can I help calm that stress response adrenaline system. If they're craving the high-fat, high-sugar food, if they're in that cortisol system, then I can work with them about what are some healthy, high-fat, high-calorie foods that you could have at easy access. So the blueberries and the strawberries and fruit and the avocados and those types of healthy fats. Nuts are a great example. And then thinking about habit change and habit formation and all the science with that, where we know if you make something easier, you're more likely to do it. If I'm really stressed out, that means I have extra sugar and oxygen flowing in my veins. And if I'm a kid at school and I have to sit in class, it's just all that sugar's just sitting there. Or if I'm having to sit in another Zoom call, or if I have to sit at my job at work, where does all that energy go? So that's where physical activity can be so amazing. Even just brief 5-minute breaks, letting kids actually be active and jump up and down in class for a few minutes can really help regulate that energy response. We as adults can do that too. And then of course, regular exercise is so important. There are so many free actual apps and YouTube videos and programs. There's so many ways that we can engage in that mindfulness for ourselves and our patients. And as a provider, practicing all of these strategies as well is so important so that we can be in a good, healthy spot to be healthy and be healthy with our patients. As providers, write nature prescriptions for our patients or connect them to eco-therapists and animal therapy and getting them out in the wilderness and adventure-based programs. Not everyone who experiences ACEs is going to have a mental health issue, but for those that do, there are so many evidence-based, trauma-informed, and trauma-specific mental health therapies that we can consider and really connect our patients to and be thoughtful about connecting them to those trauma-specific interventions. So that could include things like trauma-focused cognitive behavioral therapy, eye movement desensitization and reprocessing, or EMDR, neurofeedback. There are just so many great therapies. There's also amazing dyadic therapy. So when we're thinking about the parent-child relationship and maybe even parents who have ACEs, how can we support them in really bonding and attaching and connecting with their child? So there's things like PCIT, parent-child interactive therapy, and CPP, child-parent psychotherapy. So there's so many great ways that we can connect people to services and resources and really trauma-specific mental health interventions.